Patient is a 64-year-old female admitted to acute care with progressive right-sided weakness. Patient is diagnosed with a left-sided CVA. All other tests are unremarkable. Patient does present with a past medical history of being diabetic. Patient is currently alert with mild dysarrhythmia, but can follow complex commands and is fully intelligible. No signs of neglect or apraxia are present. However, the patient does have mild right facial droop and right-sided hemiparesis with no voluntary dorsiflexion of the foot and right shoulder subluxation. For my intervention, I focused on bed mobility in order to increase independence with mobility and decrease possibility of pressure ulcers. Patient will be returning to a 2-story home with her husband, and being diabetic, she will be at increased risk of contracting a pressure ulcer. The body structure and impairment I chose to focus on were spasticity of the upper and lower extremity, as well as strength of the lower extremity. With increased spasticity on the right side, the patient will have decreased mobility in the bed and with transfers, as well as possibility of a contracture. Interventions for spasticity that I chose was a few minutes of ice on the biceps and ACE wrap of dorsiflexion for control in the ankle. Then I used approximation of the upper and lower extremity to inhibit spasticity and encourage the new lengthened position. Decreased strength in the lower extremity will limit this patient's ability to safely and independently return home with husband. So to address this, the patient will be flexing the hip or marching on the side of the bed, as well as some bridging in the bed. Increasing this patient's lower extremity strength will allow for ease of movement in the bed and allow patient to become independent with transfers and gait. It is important to get this patient back to independence as much as she can, as she will be returning home with husband, and we do not want to injure or hurt him in any kind of way as helping her transfer. As well as we don't want her laying in the same position or sitting in the same position without being able to weight shift or move off of an extremity that may be getting a pressure ulcer. This patient will require some tactile and verbal cueing for accuracy, as well as some patient education for prevention of contractures as well as pressure ulcers.